Hello everyone, welcome to our channel today. Today we're going to discuss one topic in Wong disease. We're going to discuss one case in this video of the severe fever. In Chinese medicine history, from thousands of years, from Huangdi Neijing to Sanghan Lun, which is from about 2,400 years ago to 1,800 years ago. From these two milestones, we see the theories were developing, from the theories of internal disease to external factors, like the patient, like Sanghan Lun, it talks about the cause of disease is due to the body was attacked by cold, and for the thousands of years, we use these theories to treat a variety of different diseases. Until 16th to 17th century, yet another theory was developed, which is Wong disease theories. In Wong disease theories, because they are very typical characters. So for Wong disease, they always in acute stage, and it may be epidemic disease. It may be the diseases may happen in, or may more likely to be happens in certain seasons, such as springs or winters. And the period of disease, sometimes in most conditions, is short. So it's not like the internal disease. Sometimes it's long, it takes very long time to heal. For this Wong disease, sometimes the period of disease is short. So you have the characters of acute attack, and the disease may develop very quick, and the period of the disease normally is not very long. So these are the characters of Wong disease. A few days ago, we received one patient from our clinic. She was attacked by her symptoms at the beginning was very similar to common cold or flu or mild flu symptoms, and later on she became severe fever, which is 39.3 degrees, and then this disease in Wong disease we call Feng Wong. Feng Wong is the name in Wong disease. It was the cause of this disease was attacked by heat, especially in winter or spring. There's some typical aspects in this disease. At the beginning, the patient may have the symptoms of weight level. In Wong disease, when we treat the patient for Wong disease, we always use the 4-level differentiation method, which is weight, qi, yin, xue, or blood level. So these 4 levels. So for Feng Wong, for this disease, at the beginning, the patient may have the symptom in weight level, and later on, the pathogen can go deep in the body. So if the patient will have the symptom in focus on lung or intestines. So if the pathogen focus on lungs, the patient will be coughing or even short of breath, a lot of phlegm. If the pathogen goes to the intestine, the patient will be constipation. And all these 2 levels, the patient may have severe fever. And the last part of this disease, the patient may be qi and yin deficiency. So this is the typical characters of this kind of disease. Feng Wong in Western medicine, it can be variety of different diseases, especially with fever, such as pneumonia, different kinds of pneumonia, bronchitis, acute bronchitis, or common cold, or even flu, epidemic diseases, and so on. This patient, she was a female, and she came to us on the 5th of June. So it's last week. On the 1st of June, the main complaint of the patient was runny nose, blocky nose, slightly cough, slightly phlegm, sore throat. And the stool is normal, there is no fever. The tongue was dark red and the coating was thin. The pulse was floating, slippery, and powerful. So at this stage, we use the formula of 三奥汤. We add 玄参、连翘、紫苏叶、薄荷. So if you can remember, we have discussed 三奥汤 in our previous video in the spurring formula for the pathogen in superficial level. So we prescribe this formula for the patient. The second day, on the 6th of June, the patient came for a follow-up. In the second day afternoon, the patient became fever. The temperature was 39.3 degrees, and these 2 days there is no stool, so it's constipation. The tongue was still direct. The coating was similar to before. So here we add 2 herbs. The first one is 石膏 45 grams. The second is 代黄 10 grams. We only use for 1 dose, so we only gave the patient for one day's dose. We asked the patient to add these 2 herbs into the previous formula. The third day morning, on the 7th of June, the patient came again. The fever, the temperature dropped to 37.2 degrees, and was nasal sounds. The nose was blocked, and cough, dry mouth, bitter taste. There is no sore throat. At this stage, we changed the formula again. We asked the patient to stop using the previous formula. We prescribe another formula, 竹叶石膏汤. This formula we just discussed in the previous video. I think it's only 1 or 2 videos before this one. So if you are not familiar with the 竹叶石膏汤, you can just have a look for our previous video. We got video to talk about 竹叶石膏汤 specifically. We prescribe 3 days for the patient. The patient came for another follow-up treatment on the 9th of June. The patient said, these 2 days, during the day there's no fever, but at night there's still slightly fever, range from 37.2 to 37.5 degrees. And when she woke up and get out of the bed, the temperature will drop back to below 37, which is normal, and slightly runny nose, a little bit phlegm still. So at this stage, we use another formula, 沙参麦冬汤. 沙参麦冬汤 we're going to discuss in the later videos. Is a formula to tonify yin and tonify qi. We modify 沙参麦冬汤. We add 地骨皮, we add 胡黄连 to 沙参麦冬汤 and 牡丹皮. These we want to use these herbs. We use modified 沙参麦冬汤. We add 地骨皮, 胡黄连, 牡丹皮. These a few different herbs together for this patient, and the patient was healed. In this case, the patient from the beginning to the end was less than 1 week. But in this 1 week, we used 4 different formulas, which means we change one formula, 1 to 2. We change the formula every 1 or 2 days. Why were we doing this? From the first day, when we go back to the case, from the first day, the pathogen was in Wei level. So we use San Ao Tang. We modified San Ao Tang. We use San Ao Tang and Yin Chao San to disperse the pathogen in superficial level. The second day, the patient has severe fever, has constipation. So the pathogen goes deep in the body and it go to the intestine, it combine the heat, combine with the intestine, it causes constipation. So we add Shigao, we add Dai Huang for this condition to cause diarrhea. Once the stool passes away, the heat will be relieved as well. So the heat is nothing to combine with, which is much easier to clear the heat. This theories we also discuss at the general introduction of heat cleansing formula. On the third day, the fever is not as severe as before, and the stool was normal, but the patient still have slightly fever. At this stage, the pathogen is weak. That's why the fever is not severe, and the patient's energy, the immune system of the patient is also weak. Because fighting with this disease for a few days, the immune system is weak. The patient also is not strong, just in general. So on the third day, we change the formula to 竹叶石膏汤. 竹叶石膏汤 can tonify qi, which is to improve the immune system, can tonify yin. So on the fifth day, most of the symptoms have been relieved, but the patient said the recent 2 days she got fever at night. During the day, she's fine, there's no fever at all. Why the patient will have this kind of symptoms? This is because the pathogen in yin level. When the pathogen in yin level and the pathogen is not severe, it's not strong, and so during the night, the pathogen will have the backup from the environment, because during the night, the yin can support the pathogen. That's why I have slight fever. So at this stage, we use 沙村麦冬汤. We add 地虎皮, 牡丹皮, 胡黄连. In this formula, these 3 herbs can go deep in the yin level, can help to relieve the remaining pathogen. From this case, we can see the wound disease. For wound disease, we don't prescribe for long-term formula, because this kind of disease can change. The symptoms of the patient will be changed very quick, so we need to adjust. Or we need to even change the formula according to the symptoms. So for this kinds of disease, we only gave them 1 day or 2 days. Then we see the patient again to see if the symptoms have been changed or not. Secondly, this disease, when we use the formula, because of the severe fever, we use the herbs. Sometimes we use the cold herb, severe cold or very cold herbs. At this stage, we need to be careful. We don't use too much. We don't overdose. Because if you overdose, you will damage the digestive system. If the digestive system was damaged, it will cause the other problem. So we need to be careful. That's why on the second day we gave the patient one dose of Shigao and Daihuang. We don't require her to take for a long time. Thirdly is this common disease is due to the heat. So the patient may have yin deficiency and qi deficiency. So at the later phase of the treatment, we need to use the herb to tonify. To tonify we use later herbs to tonify. To tonify the qi and yin also can improve the immune system. But when we use the herbs to tonify qi and yin, we need to be careful. We need to choose some herbs which tonify yin, but it's not hard to digest. Such as, for instance, we don't use Ejiao, we don't use Shudi, we don't use Huangjin, these kinds of tonify yin herbs, nourish yin herbs. We use Maidong, Shengdi, Shasheng, these clear light herbs to tonify yin. Also, the other aspects we need to remind the patient: do not eat too much. Do not eat too much, especially too much greasy food, because if you increase the burden of the digestive system, it may cause the disease. It may cause the disease happen again. Thank you for watching our video today. For more information, you can visit our website.